Welcome. I'm Claire Anderson. I'm a senior policy fellow at Chapin Hall at the University of Chicago, and I'm delighted to welcome you here today to this briefing about economic and concrete supports that help families thrive and what we are learning regarding child abuse and neglect during the pandemic. I'll be moderating today, and we'll have remarks from Dr. Robert Sege from Tufts University, Ruby Goyle-Karki from Social Current, who's standing in today for Amy Templeman, who's not able to join us, Victoria Hilt, Betty Hawkins, and Lucretia Rose from the National Parent Partnership Council at the Children's Trust Fund Alliance. I'm going to ask each of our panelists to speak for about 7 minutes, and then we'll have questions and answers for about 20 minutes from you all in the audience. We ask that you use the chat feature to pose your, actually, I'm sorry, I'm going to retract that. Please use the Q&A feature to pose your questions, and we'll be reviewing those and answering them. And we want to just remind everybody that this event is being recorded. And a recording of the briefing will be available afterwards. So we really appreciate you being with us today. The panel will be discussing emerging evidence and personal experience from the pandemic related to family strengths, strengthening families, and child abuse and neglect. Child abuse and neglect are preventable, solvable, and policy solutions do exist. And many express concerns about increases potentially in child maltreatment during the pandemic. There's a large body of evidence and research on the provision of economic and concrete supports showing associated reductions in child maltreatment and involvement with child welfare. And as we know, 2 major federal policies during the pandemic provided additional resources to parents. So today we'll explore some of the evidence and hear from parents regarding their own experiences to inform how we can begin to develop an understanding of the interplay between system level supports and family level experiences during the pandemic. And we'll dig in a bit into the research and what we are beginning to learn. And we'll listen to the experiences of families. And I think several interesting hypotheses really emerge. Government assistance to families in financial distress may be protective. Increased parental presence and engagement in the home may promote attachment. Parents and children may be building stronger relationships by collaborating in the home around a variety of activities. And we know that positive parenting practices are widespread. And seeing those emerge during the pandemic may be providing a substantial risk reduction for child welfare involvement. So thank you for being with us today. And first, I'm going to start with Dr. Robert Sege of Tufts University. Dr. Sege.
Hi, first of all, thank you all for attending, and it's a pleasure to be here with this panel and to get a chance to lead this off. My name is Dr. Bob Sege. I'm a child abuse pediatrician at Tufts Children's Hospital in Boston. And what child abuse pediatricians do is when our colleagues or staff at the hospital are concerned that a child might be abused, they turn to us for advice to figure out how to medically evaluate a child or gather social information to determine whether their injuries or illness might have resulted from abuse. And I've been doing this for about 20 years, and I have seen many families and many kids, some abused, some not. And what I've come to appreciate is what the research shows is exactly right. Most parents really love their children, but when family stress gets really high and the baby cries and won't shut up, or the teenager won't listen, or all kinds of things happen, parents can, in a moment, lose it, or if they're under such economic stress, they may neglect the child not because they don't love the child, but because they simply can't get it together to get the resources. And of course, parents who suffer from mental illness or substance use disorder are unable to do what they really want to do, which is love and protect their child. So when I heard about the pandemic starting in March of 2020, I kind of panicked, right? Because I knew this was bad. Families were going to suffer from illness. There was going to be economic dislocation. People were isolated. It was going to be super stressful for families. And like many of my colleagues who work with child abuse, I was concerned that child abuse was going to skyrocket because what a horrible disruption. However, I was wrong, really, really, really wrong. And what happened instead was child abuse seemed to go down. So we know reports went down. And reports are a funny thing. They come from all kinds of places in various numbers. But when children are reported to the child welfare system, there's a whole process that happens to see whether the child was actually abused or neglected or not. But bottom line, the reports went down and it was way more of a decline than you could expect simply because kids weren't in school. Reports went down around 50%, and ordinarily schools file about 20% of the reports. So one piece of evidence, reports were down. Then, sometimes when children get physically abused, they get injured and they come to the emergency department. So my colleague Allison Stevens and I from Tufts analyzed or reanalyzed data from all of the United States emergency departments provided to us by the CDC and found that child physical abuse went way down in the end of March 2020 and stayed down, gradually rose up over the course of the rest of the year, but never quite to pre-pandemic levels. So maybe parents didn't bring their kids to the emergency department. What about those kids who were seriously hurt and needed to be hospitalized? Those also went down. And there are reports in scientific journals that show that overall childhood hospitalizations for abuse went down. And the ones that always make it to the hospital, the kids who were seriously injured and end up in the ICU, those also went down. They went down by about 50%. So how can this be? There's this pandemic, right? And all these things are happening, but child abuse goes down. So one of the things that we did is, together with the American Academy of Pediatrics and Prevent Child Abuse America and the CDC, we did a survey. And we asked 9,000 US parents in 3 waves what was going on at home. And what they told us was, yes, they were stressed. Having a child at home is stressful. There was a lot of dislocation from jobs, a lot of childcare problems. But the majority of parents found that they grew closer to their children. Spending more time with their kids drew them closer. And more time, not only was school out, but so were the after-school activities, and commuting time was down. And this was spotty, right? Because some families, the parents still needed to work and they were essential workers, and it was a struggle because childcare was closed. But overall, families did things like they played with their kids. They went outside with them. They played catch. They cooked together. They read together. They watched television together. They did all kinds of things together, and they grew closer. So we next looked at what they said happened to them. And many families said that they received assistance. Over half of US families, about half of US families, received more assistance. So, and this was going back to things like the stimulus checks and expanded unemployment insurance, child tax credits, expanded food stamps, protection from eviction, all kinds of things. So going back to my knowledge as a child abuse pediatrician and thinking about those families that I had seen where their children had been abused and neglected, and it was so easy to see that they themselves were really suffering, I realized that maybe families were less stressed because the economic support brought them out of poverty, because they weren't going to be evicted, because being resilient people, they managed to continue their connections via Zoom or phone or whatever with extended families. They had the connections inside their family, and all of those things really protected them. So now I'm feeling that we know something that we didn't know before, that prevention works. In addition to the economics, my group and I have gone around and talked to about 20,000 people during the pandemic about early childhood issues. And we've heard stories about the school principal who called every child in his K through 6 school to see how they were doing, about school bus drivers in rural areas who delivered food to the children who they knew usually got school lunches, but couldn't get there. And we heard from home visitors who, in a moment's notice, weren't able to visit these vulnerable families at home, but instead not only reached out to them virtually, but reached out more often. And not only reached out more often, but helped them get food and other supports that they needed and helped them stay connected. All of those things have been thought of for years as these things, the informal supports, the formal supports, the concrete supports that reduce child abuse. And now I'm 100% convinced it works. Prevention works. We learned during the pandemic that we can protect children from being abused. And I'm on today's press panel because I think that this is a wonderful thing about our country. When disaster struck, we stepped up. We increased concrete supports. The home visitors increased their contact with families. And sure, it didn't reach everybody. And we know there were pockets of people that it didn't reach. There's a lot of inequity in our country that caused a lot of problems. But still, overall, we kind of did our best. And I'm very, very hopeful that now, having seen what success looks like, we'll gather again as a country and prevent child abuse, because we know child abuse lasts a lifetime. Claire, I think
Thank you, Dr. Sege, very much. And I'm going to turn to Victoria Hill from Washington State of the National Parent Partnership Council at the Children's Trust Fund Alliance. Welcome, Victoria. Thank you.
Thank you very much. Yeah, so I live in Washington State and I am a parent, and my name is Victoria Hilt. And I want to talk a little bit about my experience during the pandemic, what it was like to be a parent during the pandemic and what I saw. So first, I want to go back just a little bit and talk about how when I was a child, I was consistently encouraged to kind of downplay and push through any discomfort or any illness, because my attendance and productivity were way more important than taking a day to rest or for self-care. And for the first time in my life during the pandemic, both parents and children were actually encouraged to be home when they were ill. That's the first time I've ever seen that. For the first time, we were encouraged to stay home with our family when they were ill and to take care of our own mental health. It's the first time that I've ever heard that for both parents and children. So now my child is growing up with a different mindset, and she's growing up with this understanding that her and her health are more important and worthy than meeting some attendance metric that someone else has set or that is designed by the school system. And her well-being directly impacts her and her community. It's a completely new perspective that I get to be a part of and encourage in her development. I've been able to set an example for her that prioritizes self-care, which in turn makes us more resilient when times of stress do occur, because they will occur. And I get to show her that there are some things that are completely out of our hands, like a global pandemic, but that we can get through it because we are able to be resilient and take care of ourselves. When she developed the symptoms of COVID-19, we were able to take the time and listen and respond to the symptoms and not react out of fear. And because of virtual learning opportunities, she was able to connect with her classroom and her peers and her lessons and not fall terribly behind, while still working on getting better with that priority of get better. I was encouraged and supported to take time away from my commitments to take care of her needs because as parents, that's what we need to do. I also witnessed some things that I think are very pivotal and important to know. I witnessed parents who were less afraid of losing their job and missing the work because they couldn't be fired if they had COVID, legitimate reason for not being at work. They were less fearful of missing the work because they had a little extra cushion of assistance when they received the stimulus and the child tax credit. There was less fear of, if I don't go to work, we won't be able to pay the bills. I witnessed businesses realizing that when they prioritize the health needs of their employees and the well-being of their families, they actually had better productivity. And so they were encouraged to do that more because they're realizing that what happens to one of us happens to all of us. And I think that really during this pandemic time, we realized that we do impact each other so much. And so we were encouraging everyone to stay on the safe side and stay home. Don't spread that COVID pandemic everywhere. Instead, take care of yourself and come back when you're okay. And I've never seen that before. I see some businesses still, even though the big push of, oh my goodness, fear of COVID-19 has passed, some businesses are still prioritizing those things because it is so important to value their families. And they're healthier and safer workplaces to come to as a result. And I think that ultimately what this means, and ultimately what this tells us, is that when we support families to take care of their families, they will, and they do. And that's just what I saw. I mean, there were other things as well that definitely helped during that time, including our social connections by virtual support groups, even with people I couldn't see face to face, but I could see them across the country. Caring conversations once a week, some respite calls with some colleagues. These things kept me going so that I could take care of my family and we could make it through. And I really think that what the pandemic taught me is that what happens to one child happens to all children, in the sense that when we support one child, we're supporting them to support their peers as well. And so my daughter was able to maintain connection with her peers throughout the pandemic virtually. And I think that that made a huge difference in all of their social connections for future generations.
Great, thank you so much. I want to continue to encourage our participants to put questions in the Q&A function. A few have come in and we'll get to those as soon as everyone has had a chance to talk with you here briefly at the beginning. I now want to introduce Betty Hawkins from Oklahoma, also of the National Parent Partnership Council at the Children's Trust Fund Alliance. Thank you.
Thank you, Claire, and I'm so happy to be here today. And I am here today to speak mostly about economic stability that happened during the COVID crisis or the pandemic. I believe that the dynamics that are involved in economic stability in minority groups have been long ignored. And economic stability is the biggest factor in safe and supportive families that make up a whole family. The barriers to even healthcare is financial. And the reason why those finances are so important is because if you don't have the finances, you are not able to get all of the benefits from healthcare, such as dental care, therapy, all those things that are important to have being a productive person. And then again, when I speak of minorities, I'm not speaking of people that are black, brown, red, yellow, white. I'm speaking of a group that encompasses all these races and all these ethnicities. The minority I'm talking about is people like me. They're well known, but easily forgotten. That minority group is people or older adults over the age of 55 that are still raising children. People in Oklahoma, there are 90,000 children today that are being raised by older adults over the age of 55. And because of trends like addiction, neglect, prisons, all of those problems in our society, we have stepped up to take on that parental role. And because of that, it has put us in some peculiar situations, you know. We worked hard all our lives and expected to have a certain quality of life in our later years because of our hard work. And because we are slightly over the poverty level, we do not qualify for benefits from the government like everybody else do. Like, let's say utility, mortgage payments, and as Victoria talked about, SNAP benefits. This has put us in a peculiar situation to where we are now in a parental role. And because of that parental role, our finances have become less than we thought they were going to be. Now, I know that the COVID crisis was awful, and I dare to say that there were some accidental benefits that came out of the COVID crisis. One was which that Victoria talked about, the earned income credit. We got that. We never have been able to get that because we don't work anymore. But we still take care of kids. We still are responsible for kids. My son was born with Down syndrome, and his speech is unintelligible. And he goes to a suburb in Oklahoma City called Norman, where he gets all of his treatments, like occupational therapy, speech therapy. And I have to drive 30 miles one way, let's say 60 miles every week to get his therapies. Well, the one thing that I benefited from was that the therapy was done online in a virtual room. I learned how the instructors or how the practitioners or therapists did their jobs. I was able to mimic those jobs at home, which brought me closer to my child. I learned how long his focus was, how to deflect those things and bring him back to where he needed to be. Also, I was able to breathe a little bit. Because of the benefits we got financially, those overdue bills, electric bills, light bills, gas bills, I was able to catch those up because I had more money to spend. I didn't have to worry so much about how much I was going to spend on groceries. I got the allowance for supplemental income allowance, and I was able to, it was just such a breath of fresh air for people like me, you know. I don't know how it affects everybody else, but for us, people, women and men over the age of 55 is taking care of children. the laws, the policies that cause us to be discriminated against for those benefits that we need it was just wonderful for me. So I don't have a whole lot to say anymore, and I'm just going to turn it back over to you all. But I want you to know that these accidental benefits that I had got really helped me, and I'm pretty sure it was help to all the people like me, grandparents, uncles, aunts, older adults that were taking care of kids that are over the age of 55. Thanks for letting me speak.
Claire, you're muted.
Thank you so much. Thank you so much, Ms. Hawkins. We're now going to turn it over to Ms. Rose, Lucretia Rose from West Virginia of the National Parent Partnership Council at the Children's Trust Fund Alliance.
Thank you. As Claire said, I'm Lucretia Rose and I'm from West Virginia. I work as a parent partnership associate with the Children's Trust Fund Alliance, but I also have some experience working with peer-to-peer folks at the state level and my local community level. I really have a passion for bringing peers together or having a peer-to-peer support network. And through that, I'm really fortunate to be able to actually gather data out of the mouths of the folks where policies really affect people. And today I'd like to share a little bit with you about some insight on a couple different levels, the national, state, and local level and community level, and some of the things that were shared and what really made a difference. And then I'll also share how that really affected me as a parent in my community. So first, at the national level with the Children's Trust Fund Alliance, I was really fortunate to be able to participate and help execute a project called the Resiliency Project. And it was through that there were two main parts, the first of which was Caring Conversations, which is a weekly group where we got together virtually, and it started out as us just kind of checking in through COVID when it hit, and really became a support system for us that still continues yet today. And the second part of that was being able to provide concrete supports for families through using Touchpoint Parents, which is kind of like a peer-to-peer model. From the Caring Conversations, we were able to realize that a couple folks might have needed some ongoing, more personal supports. And so we would have one of their peers reach out to them individually and have some one-on-one conversations. And it was through that and through the use of flexible funding in partnership with Casey Family Programs and the Children's Trust Fund Alliance that we were able to really support families in ways that they might not have been supported had it not been for that flexible funding. Some of those ways were preventing homelessness by helping secure housing and helping with some food insecurities, car repairs, being able to pay utilities. Because it was through those conversations each week that we found out that parents were really loving the slowdown and being able to concentrate on their families. But that was only possible when their basic needs were being met. And at a time where we all were feeling like we didn't know what was going on and we all needed help, that became even more apparent that it was really key to provide those concrete supports for those families so they didn't have the high levels of stress. Also through my work with the Children's Trust Fund Alliance and part of the work of the Alliance National Parent Partnership Council, which Betty and Victoria are the co-chairs of, we decided when COVID started to take control of the narrative, because we were hearing over and over that these kids are home with their parents. Oh no, what are we going to do? They're not able to go to school. We can't protect them. And we didn't like that narrative. We know that that is true. And we certainly didn't disagree with the fact that, schools and folks in those roles are really key in helping, keep children safe at home. But we wanted to let folks know that we were building our own protective factors at home, and we wanted to change the narrative. And so part of taking control of that narrative, we decided to develop a tool called the Conversations for Better Normal, in which we wanted to know how parents and families were building protective factors through the COVID pandemic. And we used the logic model and the everyday actions from that logic model, from the research, and we developed questions that let folks have conversations to give concrete examples as to exactly how they were building protective factors each day. The 5 protective factors of concrete supports in times of need and how important that was, or how to build resilience. How were they staying resilient through COVID? How are they aiding in their children's social and emotional development and their competence? How did knowledge of parenting and child development play a role in that? And more importantly, how are we building social connections at a time when we were asked to be distant from each other? And so it was through those conversations and through the data that we gathered from there that we really learned that building these protective factors are important in everyday life, but more importantly, when you're facing crisis as a whole. And so it really helped us get from folks data, from parents all over the nation, of how they were building protective factors. One story that was shared is there was a young couple, and they had young children at home, and one of their children had just started school and hadn't been in school very long when the pandemic hit, and they were asked to join school virtually once we realized it wasn't changing for a while. And she did not have quality broadband, nor did she have a device in which her children could join. And whoever thought that our kids would be having kindergarten from home on a virtual device? And so her school reached out to her and delivered a computer to her school so her kids could join in on their education. So I thought that that small story would be good to share with you. In my state of West Virginia and through Team for West Virginia Children, I also help run a level of peer-to-peer support networks using the Circle of Parents model. And similarly, we were able to gather some data around how our families in Circle of Parents were navigating the pandemic and building their protective factors. And it was there that we realized that the family resource centers and home visitation and local nonprofits were really key in providing some of those same concrete supports that the national level provided through the Resiliency Project. They were delivering Meals on Wheels, and they were making sure that families had packets of games or different things to help social emotional development. Also that they were able to provide some structure to families who, maybe didn't have that at home. But it was through that we found out, parents were really creative in building those protective factors and finding ways to get things when they couldn't. And they really also reported that they enjoyed the slowdown with their children. They were actually able to concentrate on their social and emotional needs of their children that they might not have had time for before. But there again, same thing in my state, we found that the slowdown was only possible and the enjoyment was only possible when the basic needs were met. And so, having the things like the child tax credit was really beneficial. And also out of that, we learned how important it is to, once things started to kind of pick up to going back in person, or folks were allowed to start going back to work, things like quality childcare, having access to the internet, having transportation, having home visitation look different than it used to. All of those things were brought to light, and more importantly, how policies really helped shape those things and how we needed to change a lot of policies. And so it led to a lot of advocacy from parents for policy change. And here in my local community, I noticed that my neighbors and I were starting to build more of a neighborhood. When I was a kid, it took a village to raise a child. I'll be honest, now I have my support system, but it's not always my neighborhood. And so we found ourselves in places of asking for help in times that we normally wouldn't. one of the key takeaways for my family was we were pretty fortunate because I was able to work from home and continue to bring in income. But I'll tell you, that child tax credit really helped with things like my dental bills for my children. Had it not been for that, I didn't have extra funding put back. We were going through all of our extra funding at that time. And that child tax credit really helped me focus on the dental needs of my children. And more importantly, I ended up realizing that one of my children needed some mental health needs. And so we were able to help secure a therapist for him to talk to make that normal. So the key takeaways for me through families at all levels through the pandemic were that families are only able to concentrate on the slowdown and really enjoy having quality time with their families when their basic needs are met, when they are able to lessen stress through having things that they might not normally have. And that when families have a support system that enables them to build protective factors, they're really able to give more quality attention. And really, it takes supportive families and strong communities both to prevent child abuse and neglect. But families are totally capable of taking care of their own, and as long as we have the tools to do that with. And that the biggest takeaway for me probably is that COVID normalized asking for help from everyone, because there were folks who normally wouldn't be asking for help, found themselves in positions where they needed to ask for help. And it actually highlighted it, asking for help as a sign of strength. So that's all that I have.
Wonderful. Thank you so much for sharing that information. I'm going to turn now to Ruby Goyle-Karkik, Senior Vice President of Programs and Services at Social Current.
Thank you, Claire, and thank you. I'm really honored to be here with this esteemed panel and just hearing from the families' voices. We were certainly in this together in this pandemic. So I'm from Social Current. It's a national organization that advocates for and implements equitable solutions to society's toughest challenges through collaboration, innovation, policy, and practice excellence, including accreditation. And that's a lens that I'll speak from. And just by way of a quick summary of my background, I have been in this field for over 29 years, working in both the public, private sector, holding roles in direct service administration, public policy. And I've witnessed and been part of working in systems that struggled with providing appropriate access and services, but fortunate enough to have been part of and drive major system transformation for children's services statewide. I mean, as we've heard from, Dr. Segi and the families, they are the greatest asset in ensuring that children are safe and healthy and well cared for. During and beyond the pandemic, we all have a collective responsibility to produce better outcomes for children by focusing on supportive and prevention programs that help families overcome challenges, especially to prevent parents from becoming overloaded and burned out by multiple stressors. And despite the research studies, such as the one presented by Dr. Segi and research from Chapin Hall and others on the benefits of economic and concrete supports for families, prevention remains under prioritized as a public policy. We've heard from families here today that prevention really matters. Only 15% of child welfare spending is to support parents and keep children safely in their homes, compared to 45% of spending on out-of-home placements, the other 40% being divided between investigations, adoption, and guardianship. And to support the programs that have been highlighted here today, there are 3 federal programs that are due for reauthorization of Congress this year and can help to make community-based prevention more of a priority. They are the Child Abuse Prevention and Treatment Act, Title 4B of the Social Security Act, and the Maternal, Infant, and Early Childhood Home Visiting Program. A modest investment, even a modest investment in families, allows parents to care for their children the way they want to. Other critical supports to families are the expanded child tax credit, which was mentioned several times, and we've seen the reality of the help that's provided, paid family and medical leave, quality child care with improved access. Access to behavioral health services is also another critical component to supporting families during difficult times, as multiple studies have shown an increased need during the pandemic. And access to these services can help reduce these stressors and keep families from coming to the attention of child welfare. Any solutions to improve child and family well-being must address equity and racial justice. Most families come to the attention of CPS, Child Protection Services, for allegations of neglect, which are often related to economic insecurity, as you've heard. These families need economic and family support much more than child protection involvement. In fact, Child Protection Services often doesn't have the resources to provide these types of economic and family support services and doesn't do a good job of connecting families to these resources. The policy solution is to disentangle economic hardship from neglect, showing how they are different and offloading economic stressors, policies, and look to reshape them as mandatory supporting policies. More than half of all Black children and more than 1/3 of all children in the US are subject of child abuse or neglect investigations by the age of 18. This type of mandatory reporting structure does not encourage reporters to connect families with help from supportive programs before harm occurs and before families become involved with CPS. And due to its disproportionality is a racial justice issue that requires immediate attention. Just wanted to mention that Social Current is also the national technical assistance provider for a federal demonstration initiative funded by the Department of Justice called Child Safety Forward. Our partners at the Michigan Department of Health and Human Services are putting equitable solutions into practice as they expand family resource centers across the state and improve safety planning to better address serious injuries and child fatalities from abuse and neglect. Through a collaborative approach to systems change, they are looking to respond differently to neglect allegations by focusing on protective factors and working to promote supportive services to families. And as a federal commission to eliminate child abuse and neglect fatalities stated in its 2016 report, within our reach, child welfare agencies cannot do this work alone. Media can help to improve outcomes for children and families by covering child welfare more thoroughly, beyond the tragedies that occur, and increase public attention to prevention programs that work. In a national survey of parents with young children, even before the pandemic, 48% of parents report not receiving the help or support they need. Together, we can illustrate that a community-wide public health approach to child and family well-being is required so that all parents are supported and that all families can have the opportunity to thrive. Thank you.
Wonderful. Thank you so much. I appreciate hearing from each of our panelists. We're going to transition to the questions from the reporters. And first, Dr. Sege, I'm going to ask this question for you. Where is the 20 to 50% reduction data coming from? Can you provide dates or sources, time periods to help us better understand the reductions you're describing?
Sure. The data about child maltreatment reports comes from the federal government produces something called child maltreatment each year. So the data on the reduction in 2020 comes from child maltreatment 2020. And we have a slide that comes from there that shows the reduction in child maltreatment referrals from 2016 to 2020. And I can provide the reference if you need it. It's from the National Center for the National NCANS. Everyone know what that stands for? National Child Abuse and Neglect Data System. NCANS, National Child Abuse and Neglect Data System. And that's where the data about reporting comes from.
Terrific. Thank you. We have two more sort of data or evidence related questions. Dr. Sege, I'm going to turn first to you, I think. Mm-hmm. Are we identifying child abuse as physical abuse and neglect only, or does it encompass sex abuse as well in the reductions that are being seen?
The most common form of child abuse and neglect is child neglect. And that tracks very closely with poverty for obvious reasons. The second most common kind is child physical abuse. And as a physician and someone who does child abuse work, that's the kind that's brought to my attention most often. Child sexual abuse is harder to track. Often there's quite a delay for children between the time of sexual abuse and the time that they disclose and those statistics come out. So I think that the statistics that I'm aware of, and I don't know if any of the panelists know more than I do, I really don't specifically cover child sexual abuse during this period.
Great, thank you. Quite similar to a question regarding sex abuse, that sometimes there's a delay in disclosing. And for neglect and physical abuse separately, the evidence we have is emerging. So this is sort of a question around, will we know more 3 years from now than we know today? Can you talk a little bit about what you think we'll be learning over the course of the next several years?
Yeah. So that's a great question. And I wish I could predict the future with great accuracy. But there are some kinds of child physical abuse that come to attention very quickly, particularly abusive head trauma in infants, which is the most serious and often lethal form of child abuse. And that showed a 50% decline during the early part of the pandemic. Hospitalizations, similarly, often the children who are hospitalized overnight have injuries or neglect so serious that their health is in jeopardy. So those come to attention right away. Other cases, it's more complicated, and I think that we'll see what happened, but I'm not sure that we'll see what happened, but all the data point in the same direction. And one thing I learned in medical school was something called Occam's razor, which is simply that the simplest explanation is often true. So the simplest explanation for reports going down, emergency department visits going down, hospitalizations going down, and serious head trauma going down is that child abuse went down. And switching from the data for a moment, you know, all of us, we talked about the pandemic with our friends who had kids and all kinds of things. And in general, how many times did each of us hear our friends and neighbors and colleagues telling us kind of heartwarming stories about the things they were doing with their kids because they had more time, or because the kids were down because they were isolated from school. And those were very heartwarming. And I've heard from colleagues who work in areas that are quite impoverished, and we heard today from some parents that that's not restricted to people we know. That's not just our friends and neighbors, that American families really love their children and took care of them during this period. So I think that what we can generalize from is the stories that we heard informally in our own social circles, how widely they applied throughout society.
Thank you. And we certainly hear that from our parent partners here today. Betty, Lucretia, and Victoria all described something similar from their perspectives here. So thank you.
You add up all those stories and there's something real there, right? Because Betty's from Oklahoma, Lucretia's from West Virginia, Victoria from Washington State. I mean, this happens all over the country. And it's really interesting that partly because of what we tune into, the media tends to highlight the disasters and not the common stories of parents protecting their children.
And we heard stories about concrete supports from community and social networks, and the ability to slow down at home as potential factors to help us understand what we seem to be seeing in the data. I'm curious if each of you could provide maybe one or two major takeaways that you have based on your experience or what you've been observing during the pandemic. And I'm going to start with Victoria and then come back around to Betty, Lucretia, Ruby, and Dr. Sege.
One or two examples.
Big takeaways. Any big picture sort of takeaway. Dr. Sege just kind of provided a few, and I think I'm encouraging each of you to think through from your own perspective what your takeaways are.
So two takeaways that I really have taken from the pandemic and the situation that we were left in was how important social connections were to our stability, and how important it is to have positive social connections, individuals who are able to help you, who maintain that positive kind of approach, and to help keep you positive, um, especially when you're going through a rough time, which all of us were. And so when you're surrounded by positivity, it makes it a little easier to get through, just a
Thank
little
you.
bit easier.
Thank
The second thing that I would say is that our children need us to have those strong social connections, to model that behavior, to support one another. And I think that what it's teaching our children is that community is important. Who's in your community, knowing who they are, supporting who they are, and being supported. And being able to say, I belong in this community, and I know who these people are. I know who my neighbors are. If something happens to my family, I know who to go to for support. Being able as a child to say that provides a sense of security, which really kind of is a concrete support that can't really be funded. It really depends on all of us to engage in. And in order to do that, in order for us to be able to do that, we had to be home more. We needed to be connected with our children more. And I think that it was something that was kind of an accidental benefit of COVID, was telling us all to slow down, play a board game with your child, learn who's in the community, who they want to play with, and maybe not able to play with because they're all stuck inside and scared of getting sick, but knowing who they want to play with. Suddenly you're having conversations with your kids about who's in their community, who do they want to play with, and having those really important conversations about positive social connections.
Thank you. Thank you so much. Lucretia?
I did share a few of my takeaways from the data that I learned, but just personally, I think it all comes down to relationships and connection. We know that protective factors being built every day are important, but I think the pandemic for us made us think more about when and where and how we're building those. And everything is better when you have quality relationships and quality connections with folks. Slowing down, picking who you are making those connections with and building those protective factors with your family. And I think for me, just on the overall broad spectrum, it really drove home how important partnership is with families. Because there are a lot of folks who are making decisions for families who have no connection with them on the ground and how it will really impact their lives. And so partnering with the folks, partnering with parents, partnering with families, and incorporating parent voice is really key for me.
Terrific. Thank you. We have about 5 minutes left. Betty, if I could have you share any major takeaways.
Yes, the most important thing to me was unity. You know, when we came together in this certain crisis, we began to elevate ourselves, elevate our communities, elevate society even, and empathy for each other, finding out what was needed and supplying those needs. I am so appreciative to people that usually don't do that even if it was by accident, that they did it.
Terrific. Thank you very much. Ruby?
Great, thank you. I think just ditto what everyone has said. Absolutely, just giving parents the opportunities, provide parents with the opportunities to slow down, connect, create those bonds. And by providing the economic supports, we were able to really support the families, either through child tax credits, through rent relief, and other means. My second takeaway would be that our current system of mandated reporting is flawed. Educators account for the majority of reports to child abuse hotlines, and yet only 11% of those reports are substantiated. So too often teachers are seeing poverty and neglect, are seeing poverty and reporting it as a neglect. But we need to look at how we can reform those mandatory reporting and distinguish between families who actually need the support and children who are truly at risk, and create those alternate pathways so that calling child welfare is not the de facto response, but actually connecting them to other resources.
Thank you. Dr. Sege, we'll end with you today.
I think that the takeaway lesson for me is really that prevention works. And we've talked about all the things that we did as a society to help families, particularly families with young children during the pandemic. Number one being concrete supports. And number two is the three parents talked about, just the informal networks that we have and the outreach that we did to each other, and what happens when parents are less stressed and have more time with their kids. I think personally that our country is wonderful. We are wealthy enough that children don't need to live in poverty. We've demonstrated that when we have the national will to raise children out of poverty, it's a miracle. And that is what we need to take home, that we can invest in our future. A relatively small investment from the federal government, state and local government can let parents do what they do best, which is love their children and raise them and protect them. And having seen so many families where there's child abuse involved, I never want to see another one. Anything we can do to protect children from being abused will help us now and in the future. And we know what to do. Let's just do it.
Thank you so much. And I want to thank everyone who joined us today and those who asked questions. We appreciate your participation and interest in this critically important topic, and to learn more about the evidence that is emerging and the experiences of parents during the pandemic. We have, I believe, made available materials to everyone, and we will ensure that you have those. If you have further questions or you'd like to separately speak with any one of the panelists today, please contact Casey Iranon at 253-208-7057, or, and I'll spell this for you, KIRANON at wearerally.com. And it is, that information is now in the chat box, so feel free to copy that and use it to be in touch. Thank you all so much and enjoy your afternoon.
Thank you.